It is time to reimagine leadership. My name is Ben Owden, and I would like to welcome you to a series of conversations in partnership with WomenLift Health around how can we develop new approaches to the new challenges that leaders face in the 21st century. Greetings to you. I hope you are doing well and are having a meaningful and productive day. Welcome to another episode of the Why Lead podcast. I am your host, Ben Owden. Now, in collaboration and in partnership with WomenLift Health, we are bringing you a series of conversations to reimagine leadership and to see how we can take new approaches to new challenges, particularly in the space of leadership in the healthcare sector. Now, in this conversation today, I am joined by a woman of many firsts in her country, a trailblazer, a door opener in the field of health in South Sudan and beyond. And we will be exploring the challenges faced by women leaders in the health space, challenges faced by those who are firsts, and even those who are considered legends. She's a highly skillful obstetrician and gynecologist who performs all obstetrics surgeries such as cesarean sections and laparotomy surgeries for general gynecology and cancer of the women's reproductive system. She began her career journey back in 2004 as a medical intern in Khartoum, Sudan. And in 2005, she worked as a medical officer in her rural home of Torit in eastern Equatorial state of South Sudan as part of giving back to her own community. In 2006, she worked as a director of the South Sudan HIV/AIDS Commission in Torit, where she established the first VCT center in the area. Currently, she's the resident obstetrician at Matar Hospital, Nairobi, and once again, the first gynecological oncologist in South Sudan, Dr. Idyoro Ojukwu. Karibu.
Asante.
Now, you have a very inspiring story, and your story is particularly inspiring because you have become successful while facing debilitating odds. So what's your story? And more importantly, what was the narrative that you kept telling yourself that gave you the zeal to persevere, to power through, and to be successful in spite of the challenges you faced?
Thank you for having me.
Mhm.
Actually, my father is a teacher,
Mm.
and I'm the firstborn
Mhm.
of many children. I've come from a polygamous family,
Mm.
but being the firstborn, my father actually have that confidence in me. And since we are young, he always gives me the leadership position at home. Yeah, and that was very encouraging. And I feel I'm responsible for my siblings. And that is what actually kept me moving and wanting actually to do the best I could.
Mm.
Yeah, because I was already given the opportunity. And so
You were given the responsibility as well.
given the responsibility as well.
Mm.
So I've actually started feeling responsible from early age.
Wow. And you don't just think of yourself, even looking through your story. You clearly are always thinking about how you can help others. And even in your story, once you graduated, you went back home, even in a very unstable situation. But you always found a way to go back and give back and to fight and work for the improvement, for the betterment of other people. And so some of these changes require policy transformation, and which is something that you're passionate about. And so when you fight for the equality battle, especially for women leadership in the healthcare space on a policy level, it can be a very long, winding journey sometimes. So what keeps you grounded and resilient as you fight to advocate for inclusion of women at high levels of leadership in the health space?
Yeah, actually, in that space, sometimes as women, we get discouraged along the way.
Mm.
You are trying to push things in place, and then you get this resistance. Then at some point, you actually feel like, no, I should just give up.
Mm.
Why stressing myself? But sometimes when you actually retreat and sit back, you will see like, now that one, I think it still needs me.
Mm.
So I still have to go back. Like After I finished my registration, specialist recognition in Kenya, after finishing my master's, I worked in Kenya for 2 years, registered as a specialist. I decided now, let me go back and serve my people. So I went back. I really got a lot of resistance as a junior consultant in the department. So, like Honorable Helen Clark was saying about pregnancy, that actually happened to me. I was heavily pregnant. Now coming back to Nairobi to give birth. Just after I turned my back from Juba to Nairobi to give birth, I got a letter of dismissal.
Wow.
That you have absconded duty. And everyone knew I was expectant. Definitely when you're expectant, you have to give birth. So I got so frustrated. But the good thing is when I left Mata and went back, I told them I want to go back to South Sudan and serve my people. So I was actually given, you can go back, but Daktari, whenever you need to come back, the door is open for you. So when I came back, I gave birth. I was so frustrated. I didn't want to go back. I went back to Mata, and they really welcomed me with open arms back. So I went there. I sat. I was working, but years down the line, I still think. I was thinking what I met back home. And what actually came first was how women were actually suffering because of cancers, gynecological cancers in the wards in Juba Teaching Hospital. So I said, okay, I think I still need to help. And that is what actually pushed me to go back and do the gynecology training. Yeah, so as women, we have that heart of helping. Even after push, we still get back to our senses and think we need to go back. And that takes actually what a leader is to do that. Because at sometimes you can just get frustrated and say, wachana na hiyo maneno. Let me go and have peace somewhere. Yeah.
And you feel...
yes, and actually the resilience. We need that resilience in us. Yeah. So once you are resilient, I think that is when you actually get the agility to get back and start afresh.
And you feel like the resilience is much more easier to, I guess, develop in women. Because sharing the story that you just shared, meaning that you were in a much better situation in Nairobi, but your heart still ached for what you saw back home.
Yeah, that is true. But resilience is actually not something that is able to, you are easily to build. But I think my experience where I grew up, I started the school at the start of the South Sudan Civil War. And all along, I have that experience of hardship. From home, instability. We move from our house to relatives' places because now there is fighting. And again, like when I went to high school, now my dad decided, now you cannot, I'm investing in you. You are the elder person for me. So you need to get a better education. So actually, I left my parents in Juba and my dad decided I should go to Khartoum, where my uncle was. So you go, you stay with your uncle so that you get a better education in Khartoum. So you see, someone at the age of 15 being sent away from home for education, that actually is already building resilience in you. Yeah.
So resilience is sort of built through hardship and
that is all for me. Maybe for other people it's different. But for me, I think my resilience came through actually the hardships that I went through.
Wow. Yeah. I think there's a saying, right? What doesn't kill you makes you stronger. And I think in your case, that statement seems to be true. And so part of, again, speaking on this idea of resilience, because like you're saying, when you're fighting for any sort of equality or when you're fighting for a door to be opened for others to walk in, not everyone is going to willingly open that door for you. Not everyone is going to willingly pull the chair for you to sit. You have to be extremely resilient. So I guess my as we're wrapping up the conversation, my question is what self-limiting beliefs do we have to give up, and particularly maybe women have to give up to unleash their true potential, to thrive in the workplace, and particularly in roles of leadership. And when they are required to be resilient, to have what it takes to be resilient, what sort of self-limiting beliefs that people have? Because some people go through what you went through and they become victims. But you went through what you went through and you're a victor. So what self-limiting beliefs do we have to give up?
I think women should believe in themselves. That's number one. Because more often women feel like, I can't do it. This one I will not manage. So I think once we believe in ourselves that we can do it, actually we can do. And that is a belief in every woman where they feel like they are not up to the task. And like in most situations when, let me say just during elections of societies, most of the time you see men are the ones going forward, say, I want this position. But women always sit back. So I think women should always come forward. Don't just be sitting there and think things will work for you. You have to look for them as well. Yeah.
Wow. Thank you. And so my last question to you would be a question that we ask all of our guests. It's called the 111, which is, what is the one book that you have read at some point in your life that has been so impactful that you say, I wish I had this book when I was 15, when I was 14, when I was 13. And then what is the one habit that you practice? It could be, I think Kidenji said walking. Some people say reading. Some people say praying. Everyone has their own habit that you say, I wish I had started this earlier. And then what is the one personal value that you will not compromise no matter the cost?
One personal value that I will never compromise is family, being there for my family. And at some point, I always thought, because I'm so much attached to my family, that's why I've not progressed. Until one day I met with a colleague and he was asking, by the way, how many kids do you have? And I told him I have 4. Said, no, unbelievable. 4 kids, and the way you have progressed in your career, it is very unbelievable. So that is when I felt actually I was a bit able to manage both family and career. Yes. So I think compromising my family will be the last thing. And again, I picked it from the late Wangari Maathai. When she was done that interview, when she was very sick, and she said if she was to go back in time, she would have given more time to the family than to the career. So I think these are some of the things which actually inspire me. And I feel like I think I will have to give to my family first and then balance about the work. So if you can see from my profile, it took me almost 10 years to do the gynecology after becoming an obstetrician. And that is purely because I was thinking, because this fellowship for gynecology was not available within Nairobi, where my kids were. So I was thinking, no, should I go to Eldoret? No, that will be far from the kids. If I go outside Kenya, again, it will be very far and will destabilize my family. So actually, I wanted and got open it up. University of Nairobi started the program, and I was among the first batch to do the fellowship program in the University of Nairobi. So I think this is one thing I don't think I will compromise. Yeah. Coming to books, being in medicine, I think the storybooks or motivational books that I read were very long time ago. Yes. But I think now we have this social media and digital platforms. You just come across these articles which are very inspiring. Yeah.
And the one habit that you practice now that you wish you had started earlier?
My leadership skills.
Mm.
Yes. So I think finding out that I actually can lead, it came much later. And that is when I joined the WomenLift Health leadership cohort.
The cohort, yeah.
Yes, the cohort of 2023. And that is when I knew like, I had what it takes to be a leader, but I was always quiet. And I always sit back. Yeah, so I think that is one thing that I will always say. I think we need more women into leadership. And what else? Yeah, like this leadership training, we need to involve more women. Yeah. Yeah, at least to inspire them early enough. And such leadership programs for women, it should actually start as early as when they are much younger. Let me say maybe that when they're doing their basic degree or something. Yeah. Because we got it almost very late.
Almost very late, but right on time. Thank you, Dr. Idyoro, for making the time to have this conversation with me. It's meaningful and your story is quite inspiring, and I hope that it will inspire many who will listen and watch this conversation. And to our dear listener and viewer, this has been the WomenLift podcast. I am your host, Ben Owden. Thank you.
Thank you.